often than many of us know. Today, we show you where and how falls are treated and what they could lead to. KION's Matt Sizemore has the story.
Every little kind of menial task that we take for granted is a potential insult or mechanism for people who get older.
It only takes one little accident to turn a healthy individual into a fall victim.
There might be something in the way that you don't see, you trip right over it. And you've done it 100 times, but unfortunately, that particular time, it leads to a fall.
And the results of one little spill could be dire.
Fractures, whether it be the hip or the chest, and chest meaning ribs, sternum, other extremities, but fractures and traumatic brain injury are the top two, with brain injury being the number one.
When the fall is bad enough and hospitalization is needed, fall victims in many cases are sent to a trauma center.
When a trauma is activated, regardless of severity, they will all come to this room. It's an isolated room separate from the emergency department where they can get dedicated, focused care.
And in many cases, trauma doctors will discover other health reasons behind the fall.
If they have a high blood pressure that was unrecognized, or if they were on some medications that they were needing for some other condition. Oftentimes these patients are on medications that thin out the blood for a necessary reason.
We know falls can be physically devastating, but we also know they're preventable.
Don't underestimate falls, and especially with this being brain smart, and head injuries are a very common consequence of falls and very unrecognized. And so it's important just to never think of just a bump on the head as truly a bump on the head.
In our final report tomorrow, we'll show you how fall victims get back on their feet and work their way back to a normal life.